Well, it is the president's #1 legislative priority, and it affects each and every one of us. We're talking about health care reform. But polls show that Americans are very skeptical of the plans out there, and the president's chances of reaching a bipartisan deal seem to be dwindling. In today's Washington Post, former Senate Republican leader Bob Dole writes, and quoting here, "Many of us were taught that the president proposes and Congress disposes. Today, Congress is doing both, with the president relegated to the role of cheerleader-in-chief. Obama's approval numbers would jump 10 points if Americans knew he was fully in charge. A tactical move of introducing his own plan would also stir more Republicans to become active for reform in critical areas." White House Press Secretary Robert Gibbs responding just a few minutes ago, saying any characterization of the president's role as inactive would be inaccurate. Indiana Congressman Mike Pence is chairman of the House Republican Conference. Two pretty good quotes there. You got Bob Dole saying, look, the president is not doing anything. He's kind of outsourced this to Congress. And you've got Robert Gibbs saying, wait a minute, the president is heavily involved here. Your thoughts, Congressman?
Well, thanks, Trace. Well, look, I'll tell you, I've seen it at town hall meetings across Indiana. I got 3 more town hall meetings scheduled. Republicans and some Democrats who've had them have heard the tremendous public concern about health care legislation that's been drafted in the House of Representatives. It really is time, as Bob Dole says in the Washington Post today, to start over. They ought to scrap the bill that's been moving through the House of Representatives. It's nothing more than a government takeover of health care paid for with $800 billion in higher taxes. We ought to demand the President of the United States bring forward his own bill. I talked to Bob Dole this morning personally, and he told me that when Ronald Reagan had a major legislative priority, the Reagan administration wrote a bill, sent it to the Hill, and then started the process of negotiation. What? Here, Nancy Pelosi and Democrats have written this bill with liberal priorities and shut Republicans out of the consideration entirely. And the White House has been on the sideline.
And you're saying, Congressman, scrap the bill altogether, and Democrats are saying that's a non-starter, that's hogwash, it's not going to happen. But there, there are kind of intimations that they're willing to adjust. And you look at the CBO numbers and the White House office, budget office numbers here, and do you think that the president is going to maintain this stance that this health care plan is going to be deficit neutral? Because more and more, as the numbers come in, that is a very hard position to defend.
Well, it really is, and particularly when you start to realize that where they're going to find these supposed savings are in cuts in Medicare. They're actually talking, as House Republicans published today, they're talking about increasing the cost of prescription drugs for seniors under Medicare Part D of upwards to 20% in the coming years to close that so-called donut hole. Look, this whole business is not going to be deficit neutral. We just got news that we're adding not $7 trillion to the national debt in the next decade. We're adding $9 trillion to the national debt. What we ought to do is scrap this government takeover of health care with its $800 billion in higher taxes. We ought to say, Mr. President, if this is your top priority, send us a bill, and let's have a thoroughgoing set of hearings, debates, and amendments in the Congress to consider how to improve
I know you're in the House, sir. I know you're in the House, but I want to get your thoughts on Harry Reid saying, look, you know what, we're going to give this a little bit of time when we come back in the fall because you know this is going to be the battle #1, and then we're going to push it through. We're just going to cram this thing through. How much does that polarize members of Congress, members of the House and Senate, and how much does it hurt future bills if the Democrats say, you know what, we're going to take this ball and we're going to run with it?
Well, I got to tell you, Trace, it's pretty much standard operating procedure under this Democrat Congress. Unfortunately, they pile drive through a stimulus bill. They pile drive through their budget. They pile drive through their national energy tax. So it's no real surprise to many of us that they, as they attempted to do in July, they might come back this fall and just pile drive health care reform. But Senator Reid is leaving one person out of that equation. He's talking about Democrats and Republicans.
Right.
The American people have a different opinion here. They're expressing that at town hall meetings and public forums all over the United States. I expect they're going to continue to do that this week. And my guess is, as we say in the Hoosier State, Senator Reid might have another think coming if he thinks the American people are going to stand idly by while Democrats in the House and Senate push through a government takeover of health care.
Republican Congressman from the Hoosier State, Mike Pence. Congressman, thank you, sir. Martha?
Thank you, Trace.
Thank you very much.